Okay, hi guys. I'm Dave Perna with Back and Body Pain Relief. I'm a chiropractor here in Springfield, New Jersey, and I'm here with my good friend Scott Hopkins, who's a medical doctor, and he's been talking to us a lot lately about his findings with the coronavirus. And it dawned upon me that there's a lot of people who have some misconceptions. And I thought it'd be a very good thing to interview him and get some information straight from the source, because he is a medical doctor in New York City. And this would be excellent to share with a lot of other people throughout the country, because what I feel we're seeing now is we're slightly ahead of the curve at this point. I feel like New York is about a week to 2 weeks ahead of New Jersey. North Jersey probably a week ahead. Central Jersey maybe 2 weeks ahead, and then you see different parts of the country are maybe 3 or 4 weeks behind us. So it'd be good insight to hear directly from a medical doctor who's currently involved with it, with dealing with the coronavirus, and getting their insight. So hi Scott, thanks for joining us.
Thanks for having me.
So Scott, you are in an urgent care facility. Where's the urgent care facility located?
I'm in a few throughout Manhattan and Queens, and even sometimes out on Long Island. So I see a range of different communities.
Oh, that's good to know. So we can actually expand upon that. When you're in the New York City one, when did you start seeing your first cases?
You know, it's really hard to say when the first cases truly came in, because a lot of people come in with flu-like symptoms. They're very similar to flu-like symptoms. And usually we do a little rapid strep test. Now that rapid strep test is only about accurate 70% of the time. So if someone were to come in and they had flu-like symptoms and the flu test was negative, I would assume that the test was just inaccurate. So whether that was coronavirus or what, it's very hard to tell.
At what point was the facilities that you were working for making you more aware that negative tests could possibly be the coronavirus?
I think maybe beginning of last week, we started considering testing and trying to put everything together in that respect. As far as testing, was difficult in the beginning because different labs couldn't really handle volume, and some of them didn't have the capability to even do the testing at the time.
So early on, when you guys were in fact trying to test, there were very limited numbers of tests for you guys to have access to for patients?
Correct. When we first started testing, one lab wouldn't accept the test because we were just giving out so many. And then we found other labs that were willing to do it, and as time moved on, it was becoming more acceptable at that time. But since then, it's really changed a lot because the government and the state's taking over most of the testing.
So when you first started testing, roughly how many tests were you able to perform per day?
A handful, maybe 2 or 3.
2 or 3 per day or per shift?
2 or 3 per day. Very strict criteria, and the criteria has even changed now. The rule is, New York State has advised us, if someone is asymptomatic, they shouldn't even be tested. Patients who are moderately or mildly ill shouldn't be tested either. The only people who really should be tested are those who are sick enough that need to be admitted to the hospital.
So let's go into that a little bit. Initially, there weren't a lot of tests or access to them, as you said, and now they're still being they're still being a little bit prudent and holding back and not necessarily testing everybody. Is it because if you are positive and you're not that symptomatic, really it's just go home, rest, and don't expose what you possibly have to other people? Is that the thought process?
Correct. The only reason why we do any kind of testing in medicine is if it's going to change management. Whether it's positive or negative, the treatment's the same. It's to rest, stay home, take Tylenol if need be. And if you become really short of breath where you need medical attention, at that point you should go to the hospital.
So that's the thing. I think that a lot of people have to realize, who were probably overwhelming the medical system initially, was if you weren't if you weren't having difficulty breathing, if you were just slightly under the weather, it wouldn't necessarily change how they would approach care. Is that correct?
Correct.
So
Correct.
all these people who swamp the urgent cares and ERs and the hospitals demanding to be tested early on, it really wouldn't have changed their management of their cases. I think the only thing it would possibly do is it would, if the person did know they were positive, I would think that they would be maybe more responsible about staying home versus just saying, well, it's probably just a cold then. Is that a possibility, or is that, what are your thoughts on that?
People are just scared. It's mostly out of fear. The problem is the test takes 5 days to come back anyway. So there's really no point to be tested. Even today, people come in all day long. They say, I have a cough. The flu test is negative. They were in contact with someone, or they're a high-risk patient, they're over 60, they have some comorbid conditions. So they kind of meet criteria to be tested, but there's really no point or need. If they were in contact with someone, they should stay home for 14 days anyway. And if they have symptoms, they should stay home for 7 days, or at least until they are asymptomatic or fever-free for 72 hours. So people come in saying, I think it's socially responsible for me to be tested, when the truth of the matter is it's socially responsible for them to stay home.
Gotcha. So a lot of people only think that they necessarily have to stay home if they're positive. In reality, they should just be staying home anyway.
Yeah, but they're feared, and they say, I just want to find out.
Gotcha. They want to know.
It's driven by fear and by panic.
Yeah. So at this point, has the treatment changed at all for someone who tests positive, who's, I guess, the person who is not symptomatic enough to admit to a hospital, has their treatment changed at all since day one?
From an urgent care standpoint, the treatment is just Tylenol, plenty of rest, and plenty of fluids. There are some experimental testing being done in inpatient facilities, but that's really still very early on.
As far as, here's a good question. As far as protection for you, to protect you guys, has that changed at all?
No, we're still wearing full PPE, which is personal protective equipment, which is including some type of gowns, an N95 mask, and eye guards. The recommendation isn't that it's airborne. We're just taking it a step ahead, just in case. But the truth of the matter is we really are short on supplies. Typically, you should change that gown with every patient, but we only get one per day. And even the masks, we're using them several days in a row.
Was that something that started early on, or did it just come to reality that you were going to run out of the supplies as time went on?
I think we knew early on it was going to be an issue. So from the get-go, we kind of limited what we were going to use.
Okay. Do you feel like you guys as an urgent care facility are overwhelmed right now because of this?
In certain places in Queens, we're definitely overwhelmed. Patients come in just because they want to know. A lot of people are being told by their companies they need to get tested. They know someone who's sick. Someone at home is older. An elderly person's sick at home, and they just want to know. Just want to make sure they're okay.
Now, you have also a unique perspective because not only are you working, as you mentioned, in the city, but you're also out in Long Island, which is more of a suburb type area. How different is the people's reactions in the city environment versus out in the suburbs right now? How are they preparing for this?
So I think people are much more prepared for it in the city than out on Long Island. But the amount of people who are coming in Manhattan are a lot less. The offices are much less busy than they are in Queens. Queens is overrun. And then Long Island is even kind of not that busy either. So it's different. It's different, definitely different. Yeah, go ahead.
Do you feel like the attitude of the average person is much more cautious in the New York City area versus out in Long Island, where it probably hasn't hit as hard yet?
I'd say, well, the last time I was in Manhattan was last Friday, and I was probably the only one on the train wearing gloves and a mask.
Really?
I was pretty surprised. And now this week, when I walk around Nassau and Queens, it's rare not to wear a mask. I'd say more than half the people are wearing something. In Long Island, not many masks, but there's still a run on the food, and the grocery stores is still pretty bare, but it's been changing very rapidly, I'd say.
Do you feel like, if you were to say, how far behind do you feel like Long Island is compared to like Queens and Manhattan as far as the timing of this spreading?
It's hard to say. Maybe a week. It's really difficult to say, but it is very interesting how quickly the amount of patient volume dropped in Manhattan and picked up in Queens. So maybe it's just spreading out exponentially.
Do you have any thoughts on why it's much slower now in Manhattan? Do you feel like people are just staying at home, or there's just fear of going outside, or they're just trying to avoid going to a facility where they could possibly be exposed to other people?
I think maybe, I'm just guessing, I think in Queens, it's a lot more crowded. More people are likely to have roommates, and families are in tight quarters. But I'm just guessing on that.
Gotcha. Scott, do you have any other thoughts on this? Do you have anything else you'd like to share with us?
I think the most important thing for patients to realize is it's okay to be scared, and there's a lot of uncertainty. But at this point, the last thing you need to do is, if you come to an urgent care center and you don't get tested, don't try and run around Queens trying to find the test. That's the last thing you need to do. Because if you weren't sick, that's a great way to get sick and to spread this virus. The best thing you can do is just stay home, take some Tylenol, plenty of rest, and plenty of fluids.
Thank you, Scott.
Oh.
Thanks so much for spending time with us today. Once again, Dave Perna, Back and Body Pain Relief with Scott Hopkins, MD, working in urgent cares throughout Manhattan, Queens, and Long Island, sharing some information he has on the coronavirus for us. Thank you again, Scott.
Thanks for having me.